Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a great segment for you today. We're going to be doing more Q&As. We love your Q&As. It seems to be a hit. People like to ask their questions. They like to hear their names, and then they like to get good answers. And as always, I am accompanied by the wonderful Maria / producer extraordinaire. How you doing, Maria?
Good, and you?
Good. And we're going to, this Q&A is going to be dedicated to facial surgery and facial procedures, Q&As of the face. So let us dive in and see what it is that you have for us, Maria.
Okay, so Aurora Beam 12.
Aurora Beam 12
wants to know, would you ever recommend a patient not get rhinoplasty because of the skin thickness?
Oh, that's actually a good question. So the question is, would I ever recommend someone not to have a rhinoplasty because of their skin thickness? The answer is yes and no. So one of the biggest components that determines quote unquote success with a rhinoplasty is your skin quality. In other words, the type of skin you have, which we cannot change, determines how successful or unsuccessful the outcome is. Now, by success, we are meaning that the nose is refined. It is more structured. It has more definition. So if you have thicker skin, then when we do the exact same surgery for your friend who has thinner skin, he or she with the thinner skin will see more definition, more refinement than the person with thicker skin. Because essentially what you're doing is lifting up the skin, which you can't do anything about. You rearrange the cartilage, you change the bone, you make it look really pretty. Wow, this looks fantastic. And then you put the skin back over the structure, and then you sit there and you wait. And then you're waiting for the skin to shrink and wrap around the structure that you created. If you have thin skin, bam, there you see it. Oh my God, wow, it looks amazing. You're the best. If you have thick skin, you're like, I don't know. I wanted to be.
No surgery when you do rhinoplasty. With time, it keeps
right. But so listen. So the thing is that when you put it down, you got to wait a minimum of 18 months, no matter who you are.
Mm-hmm.
But of course, 18 months, it doesn't mean it's done. It changes forever. It gets thinner and thinner and thinner and thinner and thinner. That's why people with thin skin after 15 years look super weird. And people with thick skin look okay. But the bottom line is that there's a limit to how much this thing will shrink. And if you have super thick skin, then you're going to be disappointed. You're going to come in here. You're going to spend a lot of money. One of the things you want is you want a more refined nose. And you may not get what you want.
Right.
So to answer your question, it depends on how thick we're talking. And depends on what your expectations are. So it's very rare that someone's skin is so thick that it's surgically impossible to operate. In other words, you have there's a condition called rhinophyma. It's a very rare condition. Your nose is really thick. Yeah, we wouldn't operate on that person. But everybody else that has an ethnic nose, who are ethnic noses, Middle Easterners, Asians, African Americans, Latinos, a lot of people with thick skin, their skin is thicker than some others. And so the question is setting up expectation. If the patient comes in and says, I want some really cute, tiny little nose, and then shows you a bunch of pictures off Instagram, and they have thick skin, you got to have a real heart-to-heart. That's not going to happen. Number one. Two, you got to wait a long time. You got to wait 2, 3, 4 years for the swelling to go away. So I wouldn't say that I wouldn't operate on them unless they have a really rare case. It's just I'm going to have a really honest conversation and make sure that they are realistic as to what's possible given their anatomy. And sometimes people are like, I get it. I can't, it won't be that, but can I get rid of the hump? Yeah. Can I get rid of the droopy tip? Yeah. Can I get kind of a cute little tip? No. Okay. Well then, all right. I'm okay with that. That's good enough. So that's the answer to thick skin and whether or not it's doable.
Okay. So the next question comes from It's K _1995.
Wow. Holy crap. It's gay underscore 1995.
Yeah, well, it's an underscore, the little slash.
Okay, all right, got it.
Okay, can you operate with someone having had nose fillers? And there's a two-part. And what if the patient has removed the filler, but there is still some in? Can you still operate?
So that's a great question, because for many people who don't want to get surgery, they sometimes do this interim step. It's called a liquid rhinoplasty. It's become really popular because people that are injectors, med spas, they want to do whatever they can get their hands on. And if they can trick you into getting a rhinoplasty by doing not surgery, so-called non-surgical, bam, that's a win-win. I can change my nose, go in, come out. It's affordable. So number one, I'd caution you, there's nothing wrong with doing a liquid rhinoplasty if it's being done by the right person, someone who knows your anatomy, because you can go blind. Two, and you can lose skin on your nose. Two, it's with the right product. In other words, you're not having like silicone or Voluma or some nonsense injected in your nose. And three, you're getting injected for the right reason. What's the right reason? I have a relatively good nose. I have a small hump. I want that hump to go away. So I inject filler above the hump and make the hump camouflaged and make the hump look straight. Great indication. Great indication. I fill the area above the hump that's scooped down, and the nose now looks straight. That's excellent. So number one, the answer is it depends. So if you had filler put in, I liked you to reverse, get rid of the filler before I operate on you. Why would I want that? Because I want to know what your nose looks like. I'm operating on a nose, and then the filler is going to go away, and I operated on the nose that I thought, no, you want everything out of there so I can see what the hell your nose looks like. If you got a hump, I need to know it's there. So if you had filler, I will make you reverse it and get it out. Now, what fillers can be reversed? Only a handful. So that is why I'm very adamant that if you're going to get it done with something reversible. The only product I ever use in the nose is Restylane. Only Restylane. Not Juvederm, not Juvederm Ultra Plus, not Voluma, none of these things. And you need to inject this product called Vitrease or hyaluronidase and reverse that before you undergo surgery. So that's a long-winded answer that you should reverse it, and you should make sure you're not getting cement injected in your nose.
And the reversal, is it quick? It's immediate?
Yeah, it's pretty incredible. Like, if it is a product of the HA hyaluronic acid-based products, it should reverse within 24 to 48 hours.
Wow.
Cool.
Now, you know, to do the rhinoplasty, the liquid fillers for the hump, won't it make your nose look bigger? Because when you do the rhinoplasty, you're shaving off the
makes your nose look a little longer.
Oh, okay.
But the camouflage is well worth it if you have a small hump.
Oh, yeah.
If you have a large hump, you have to fill it so much that it makes your nose look really long. So, anyway.
Okay, so here, this next question comes from Tina La.
Tina La?
Mm-hmm. And her question is...
Are you sure it's not Tina L.A.?
No, it says Tina, it's a lowercase, underscore L.A.
So maybe it's Tina L.A., Tina in L.A.
Tina in LA or Tina
or in La La Land. Okay.
Okay. Which filler do you recommend for acne scars on the face and lips?
Not acne scars on the lips. Like, what do I recommend
for
acne scars and
on
lips?
The face and lips.
So, listen, I'll just give you my general principles of fillers. You want to make sure the filler is something that's reversible, something that doesn't really swell a lot. Some fillers are thin, some fillers are thick. That's the way the molecular structure of the filler is. You use thick fillers. Okay, let me back up. All fillers need to be reversible, and I only use fillers that are HA, hyaluronic acid-based fillers. That's a type of chemical. I don't use other fillers because those other fillers can't be reversed. In other words, oh my God, I hate it. Oh my God, there's not blood supply. Oh my God, I can go into the refrigerator, get this enzyme, inject it, and boom, it's gone. So I don't want to inject anything in your face that I can't get out. So that's number one. When you inject things in your face, there are different qualities to the products: thin, medium, super thick. So naturally, each product has a place. You use thick filler in areas that have a lot of volume, and you could camouflage it, and it can be placed deep in the cheeks, in the jaw. You're not going to stick a bunch of thick filler under the eyelid or thick filler in the nose. So with acne scars, which are very, very difficult to get rid of, and filler doesn't do an amazing job, because what is an acne scar? It's a deep, deep scar that goes all the way through your skin. So you might improve it. I generally inject thin things because you have to inject it into the dermis to camouflage it. And equally, what is the main objective in lips? For them to be big? No, for them to be soft. Lips need to be soft. You inject super high amounts of volume into your lips that are super thick, and your lips look like two rubber balls. They need to be soft and luscious and malleable. So I am not a big fan of
kissing.
Yeah, I mean, that's what they were designed for.
Yeah.
Shoot, man. Now they're designed for, I don't know what, but for Instagram, I don't know what it is. At any rate, I like thin substances for scars, and I like thin substances for lips. I generally use the Restylane family. The Juvederm family is fine. I'm just not a huge fan. It doesn't matter. Just make sure that whoever's doing it knows what the hell they're doing. That's all.
Okay, we're going to take a break, but when we come back, I have a really interesting question that I had never really thought about droopy eyes.
Droopy eyes. Wow. Oh, is that a teaser?
That's a teaser.
You definitely want to come back and hear about the droopy eyes. Okay.
I want to hear it.
Okay. All right. We're going to take a quick break. We'll be right back with Plastic Surgery Uncensored. Welcome back to the second half of this facial Q&A. Questions and answers for procedures and surgeries of the face. So everyone's now, Maria, dying to hear about this droopy eye question you have. So who's the person and what's the question?
Yeah, the question comes from Maciel Cardo 88.
Wow, Maciel Cardo 88. Okay, what's the question?
Her question is, how can you lift eye corners that are naturally down facing, giving a kind of sad look, and it's not ptosis, I think it is? Ptosis.
Okay, that's actually a very good question, a very sophisticated question.
I have droopy eyes, so that's what I'm
Yeah, droopy eyes is a term that's used incredibly loosely, and it's inaccurate. It's just vernacular. So we need to be very specific. So the question is, how do we change the corner of those of the eyes if they're downward pointing? So let's just talk about anatomy altogether. When you look at people and you're like, wow, she's attractive. Holy crap, he's handsome. There are things that make people attractive and handsome, right? You're not going to look at somebody with a, I don't know, downward turning mouth corner and be like, they're attractive. It's just not an attractive quality or an attractive trait. So eyes have attractive anatomy. Some people have beautiful eyes and some people don't. So what are the key elements to an attractive eye area? And then we'll talk about this question. So one of them is eyebrows are the frame around the eyes. Men should have relatively straight brows, and women should have slightly arched, elevated brows. Some people, their anatomy is that their brows go straight and then start to dive down and go downwards. That makes the eye look droopy and downward and sad. That's the eyebrow. Next is the actual eyelid. The eyelid sometimes starts developing excess skin, and on the corners of the eye start to cover it. That's called hooding. Hooding, excess skin on the corner of the eye that makes it look heavy and hooded. That also makes the eye look downwards and sad.
Like Renee Zellweger, right?
She has hooding across her whole eyelid. Mm-hmm. She had heavy lids that she should never have operated on or needed to be operated on very subtly. Mm-hmm. That's because her whole eyelid was puffy. Mm-hmm. But I'm talking about just the corners. This person's question is, my eyelids look sad and downward shaped. The shape of the eye, like the eye goes, and drops down. It looks mongoloid or someone that, it doesn't look uplifted and Asian-like in the corners or lifted, but downwards. So brows can help have that effect. Eyelids can have that effect. Then the position of the corner of the eye. This is incredibly powerful, and this is what she's referring to. Your eye has an angle. Where your middle of your eye, the inner part of your eye, we call that the medial canthus. That's where the eye duct is. And then where the outer aspect of your eye, that's the lateral canthus. So an eye is like an almond or like a football, and each corner is the point of the football. If you draw a line from each corner to the other, now there's an axis. Eyelids that are upward slanted, that is, the outer corner is higher than the inner corner, are upward slanted. That's a desirable shape. That's an up cornered or uplifted, or we say Asian, but that's not true because Asian eyelids are more narrow. They don't necessarily mean upward slanted. If it's neutral, it means the inner eye and the outer eye at the same level. And if you're unlucky and your outer eye is lower than your inner eye, it's downward shaped. And that is what she's speaking of. So when she says it's not ptosis, she's referring to, what is ptosis? Ptosis is when your eyelid droops over your eye itself. Like you can only see it looks like dreamy or sleepy. You look sleepy, like you smoked a ton of pot. My eyes are dreamy eyes. They look a little lower. Some people's eyes are wide open. You can see the entire pupil or iris. Some people, you can only see 3/4 of their pupil. If it's really low, that's ptosis. And what she's referring to, that needs its own correction. What she's talking about is if my corner of my eye, I'm bored and it's low, can you fix that? So the answer is yes and no. It's not an easy correction. It's a really tough surgery. It's very tricky, and it can have really bad results. You actually have to go cut the corner of the eye, which they do during lower eyelid surgery, and lift the corner of the eye and suture the corner of the eye or sew it higher and change the orientation of the outer eye so that it's higher than the inner eye. Very sophisticated, not that easy to do, and requires a lot of skill. And when you do that, it changes the shape of your eye, and it's very powerful. When people, like older people, get their eyelid surgery on, they do eyelid surgery, sometimes they get little beady eyes. That's because they mess with the corner of the eye. That's how powerful the corner of the eye is. It can change the entire look of your face. And that's what she's referring to, and the answer is it can be done, but it's not something you're just going to waltz into a regular plastic surgeon's office and be like, yo, I want the my eye shape slanted higher. But I guess it can be done.
I would be very scared to do that, because if you are so picky that you want to have surgery to fix something and then it comes out and it doesn't come out the way you want it to come out, this is your eyes. It's going to stand out.
Yeah, I mean, obviously, it's a big deal. You don't do it for subtle reasons. If you're one of those people that have a severe condition, maybe you do it. By the way, don't forget about the other issue. You have 2 of them. Anytime you have 2 of anything, they got to match. So the fact that your surgeon did an amazing job on your right eye is irrelevant.
Exactly.
He has to do, or she has to do, an amazing job on your right and your left eye, and they both have to be amazing, and they have to be amazing the same way.
Exactly.
Oh my God, my right eye looks great, and my left eye looks great. Unfortunately, they look nothing alike. So, very, very tricky.
You have to be a real gambler to do that. I mean, I wouldn't do it.
All right, well.
Okay. Next comes from Hair and Makeup 111.
Hair and Makeup 111. Fire away.
I got a fat transfer on the apple of my cheeks. Can I reduce a little bit of it? And then she says Morphus.
So this person, what was her name?
It just says Hair and Makeup 111.
Okay, or her name, his, her. Hair and Makeup 111. So this person had fat transfer to their cheeks. We call, I guess, the apple of their cheek means the middle of their cheek. And presumably it's too much. And she wants, or he wants, to reduce it, and wants to know if Morpheus can do it. So I'll just start out by saying I don't know squat about Morpheus. I don't know anything about all these damn machines, because by the time I learn how to use the machine or what the machine's about or this, that, the other, machine's gone and a new machine shows up. There's machines that come out every year at every one of our conferences. It's the newest, greatest, and most incredible Cuisinart, dicer, food processor, air oven, toaster, coffee maker, and then there's another one. So right. I mean, maybe. But the question is, I put this fat in my face, and now I think it's too much, and I want to get it out. It's a difficult problem, because now you're trying to get out fat out of your face. And so that's why fat transfer is very tricky. There's not a lot of good ways to remove fat out of your face. You can't just go liposuctioning it out like you can somewhere else. Liposuctioning your face is not an easy task to do. It's not, you can use just regular cannulas. It's very tricky because there's a bunch of nerves. The skin is very fragile. And you can use other devices, but they're not designed to remove fat. So Morpheus or All Therapy or all these other devices, they're not fat removing devices. There is no, hey, I have a fat face and I want to go get this machine to remove the fat out of my face. Have you heard of that machine? No, because there's no such machine. Who the hell is going to get fat removed out of their face? So what you're saying, and your question is, can I use this machine that was designed for something else to remove fat out of my face? Maybe. I don't know.
And fat that she put in there.
Yeah, but it's not unheard of that people put in fat and it's excess. That's the whole artistry. That's why fat is tricky. If you put too little, oh, it didn't work. If you put too much, oh my God, what's this? Can you get rid of it?
But maybe I'm wrong, but I thought that fat, whether you transfer it somewhere, can continue to grow.
So there is a danger that the fat that you transfer can indeed expand as you expand. And there are...
See, I've been listening very carefully.
Right. So, Maria, you know what? After 3 years, I think you got this thing down.
Yes.
So you transfer this fat. Let's say you got it from your abdomen, which is quite common. And when you transferred it, you were 28 years old, and you put it under your eyes. And it looked pretty okay. And you weighed 127 pounds. Life happens, and next thing you know, you're 178. And you've gained 50 pounds throughout your body, everywhere. Your belly and your back and your buttock and your arms. Well, you damn well better be certain that that fat is going to expand, like all the fat in your body. But it may expand more than the other fat because it's not the fat from your face. It's the fat from your abdomen. And there are individuals, it's not that common, but there are individuals who you can see the fat transfer like, holy crap, what's that? And that's the bulging of the fat that was transferred that's not from the face. So it is a tricky art.
I wouldn't transfer if it's going to continue to grow. Okay, next question comes from Snowfire Consulting.
Snowfire Consulting. I think that's a plug for Snowfire Consulting.
Probably. I noticed so many facial plastic surgeons are suggesting doing face and neck lifts in your 40s. Do you agree, and why?
Okay, that's a great question. So there are trends, and trends are there. You know, this happens every 10, 20, 15 years. And yes, now the trend within facial plastics. What the hell is facial plastics? These are ENTs, ear, nose, and throat, doctors that do tonsils and ear tubes and etc. People who get trained in cosmetics of the face, get their training, and then they do cosmetic surgery of the face. So they do what we do as plastic surgeons. There's nothing wrong with them. They're very trained in doing facial surgery. You shouldn't be going to them for a boob job, although there are many that do it. But for a facelift, you go to a plastic surgeon, you go to facial plastics, no problem. The question is, people are doing it now and they're like 40s. And the answer is, well, it depends. Of course, naturally, as time goes on and we get more sophisticated and our appetite, our societal appetite increases, we do things at different times. Historically, facelifts were the things that you did in your late 50s, early 60s and on, because the degree of sagging in your face, the jowls and the neck skin, and all those things was significant enough that it bothered you enough that you went and got a facelift. Nowadays, by the way, so you don't wake up and you're 57 or 63 and you're like, holy crap, where the hell does jowl come from? No, your jowling starts in your late 40s. Some people don't have much of it in their late 40s, but some people have a lot of it or moderate amounts of it. Neck skin doesn't happen overnight. You don't just wake up at 64 and you're like, what is this turkey gobbler? It happens gradually. So the answer is, if you're in your late 40s, like you're 47, and your anatomy is such that you have a little bit of jowling and a little neck band and a little bit of marionetting around your mouth, and you don't want to wait till you're 62 and look like your mom, you can go and get a facelift. Of course, we'll give it a nice name to make you feel better. We'll call it a mini facelift because that's easier. That's easier to swallow. And yeah, I don't think that's terrible. That's fine. You're getting a procedure to fix a problem that you're starting to have, except you're going after it earlier. And
I think social media has a lot to do with it.
Of course,
we're seeing videos.
Listen,
we're seeing ourselves a lot more.
Social media has a lot to do with it. Zoom has a lot to do with it.
Yeah.
Access has a lot to do with it. The fact that it's more available has to do with it. Affordability. I mean, there's a million things that shape and move our society. Plastic surgery is no different. The question is it a bad idea or a good idea? The answer is, if you have a condition and you're getting the appropriate treatment for it, there's nothing wrong with it.
Right.
Some people don't want to do anything unless they have to. Then you're the person that's going to wait till you're 65. And some people are like, I don't want to wait till I'm 65. I don't want it to look terrible. I don't want to look like my mother or my grandmother. I want to fix it when I start to develop it. And there's nothing wrong with that. Where do I have an issue is when a 22-year-old who is perfect.
Oh my God.
As far as their face is concerned, maybe you need your nose done,
and
goes and gets a lip lift, the procedure that was designated and designed for an older woman or an older man whose lip is long. That's where my grief is, because now you take something that isn't there. Like if you're 47 and you have a jowl, albeit small, and you want it fixed, high five, okay. But if you're a 22-year-old and your lip is perfect, and you want your lip higher, and then you do this crazy surgery that's irreversible, and now your lip looks like it's glued to your nose. Now I'm annoyed. Now I have issues with it. Right. So the question is, should we be doing this earlier? And the answer is, it depends on what the hell we're doing. So yeah, anyways, that answers your question. Well,
I'm turning 60 next year, and I'm going to do it.
Let's do it. I'm ready.
I am like getting my mind psyched up.
Gung ho.
My husband is also pushing me.
Let me know, Maria. Let me know who does it and how it goes.
No, I'm going to do it with you. What are you doing? Okay, next one is from McLovin Guzman.
Guzman. Okay.
What can be done for the lines of the neck, known as the tech neck, which I assume because of the computer?
Tech neck, yeah. So tech neck is a very interesting and good concept. I mean, basically, we spend, I don't know, 100,000 more hours at this society than we did 50 years ago, looking down. We're looking at phones constantly. We're looking at computers constantly. This wasn't something we did in the 1950s. So when you look down constantly and constantly and constantly, you develop folds in your neck. And this sort of, they're like rings, right? They're rings across your neck. Those rings that you develop, you get etched into your neck, and they're really, really difficult to get rid of. And so it is like other things that don't have a good solution. It's a hodgepodge of various things you do to kind of make them better. There is no, the treatment for it is. There is no such thing. So what are the things you can do, none of which will fix it, all of which will make it slightly better, but then the question is if it's worth it. Number one is you can do a neck lift or a mini facelift, because often it's associated with loose skin in the neck. And if you put your hand on your neck and you start to pull up on it, you will notice that those lines get a little bit better. Two, you can do lasers or peels to soften those wrinkles a little bit. 3, you can put a little bit of filler in them. And
that's hard though. It's like all of
yeah,
it.
it's like you can see that I'm not that excited about it. I don't have a really good solution. To be honest with you, I don't really treat it. In other words, when people come, I usually discourage them from messing with it because I think you're going to do a bunch of nothing, and in the end, you won't be super satisfied. So the answer is I don't have a really good answer for you.
Okay. This question comes from Rose Marisol. Why do you prefer general anesthesia over IV sedation?
So the question is, why do I prefer general anesthesia over IV sedation? And that's a great question. So when you do facial surgery and some body surgeries, there are 2 ways to anesthetize you so that we can, technically 3 ways to do anesthesia so that we can do the damn surgery. One is pure local, that's local anesthesia. 2 is local anesthesia with some type of sedation, whether it be pills and or IV sedation, meaning we use local.
Like
Twilight. There's a million variations, like your colonoscopy, your endoscopy, your hysteroscopies. And 3rd is just old-fashioned general anesthesia. So local with some kind of oral or IV sedation, twilight, and or general anesthesia. So depending on the surgeon, the anesthesiologist, and the patient, you can come up with a plan that works for you. I, in general, do not like situations that are not well controlled. That is, I like full control of the operating experience because I want to be able to do what I need to do when I need to do it without worrying about the patient and the patient being uncomfortable and whatever. So since I believe that general anesthesia is so safe today, no question about it, when done by amazing anesthesiologists, which I only use, I'd rather you be put asleep, have your airway protected, knocked out, do whatever the hell I need to do, wake you up and send you home, than to have you be semi-moving, and then the anesthesiologist has to make you deeper. And when they make you deeper, they have to make sure you're still breathing because there's no breathing tube. And if they overly sedate you, then you're now too deep. And it's this very delicate dance. And in my humble opinion, I think IV sedation is actually trickier and in some ways more dangerous than when you're knocked out and you have a tube that protects your airway. Because now the help of the machine is they can't over sedate you. They're helping you breathe. So I don't like patients being like semi-awake and moving and being unconscious and then complaining and then they can feel it and whatever. Totally a preference. There are doctors that do amazing work and they put you under twilight. The urban legend and the problem and the mistake is people are like, IV sedation is safer than general anesthesia. That's so not true. That might have been the case like 50 years ago. But today, that's bullshit. If you are going to a surgeon who uses a great anesthesiologist, not some Mickey Mouse person that they pulled out of their ass, then your anesthesia experience is no less safe if you get general anesthesia. And my patients want to be out. They don't want to wake up in the middle and be like, hey, can I feel it? Can I hear it? So that's just the way I was trained.
And the last question.
All right. Okay. What's the final question? Drum roll.
Do you ever get, from Brianna Rose, do you ever get nervous going into surgery?
Ooh, that's a great question. Do I ever get nervous going into surgery? And it doesn't have to apply to just facial plastics, but all plastic surgery in general. The answer is yes. Every single surgery. 17 years into private practice, all that training, and every single time I operate, I'm a little anxious. Now, why would that be? It's called reverence. I respect surgery. What is there to respect? when you get into the ring with a lion, you're a lion tamer. This is what you do every year. This is what you do every single day. You had this cub, this baby lion. You raised it with a bottle and fed it milk from infancy. You've been doing this for 50 years. And you're inside a ring with this lion that you raised. At any minute, this lion can eat you because it's a goddamn lion. And there are many stories of people who have tamed animals, wild animals, bears and lions, that have been mauled to death by the animal that they raised after 50 years. And it happens when you lose your edge and forget that this animal, while it's loving, is dangerous. Surgery is a lion. And the minute you get complacent and you don't give a shit anymore and you're just whatever, is when something goes terribly wrong. And it doesn't matter if it's a goddamn mole or rhinoplasty or whoever. I'm always a little anxious because at the end of the day, it doesn't matter how many years you're doing it, it's still surgery and you have to have reverence. That's the way I look at it. That's how I've always looked at it. And I'm sure I'll be 70 and I'll still look at it that way.
Of course. Well, it's a good way to end.
All right. Well, there you have it. That's your Q&As. Keep them coming. Hope you enjoyed that one. It was facial surgery procedure Q&As. As always, if you love the show, if you enjoy the show, please, what keeps us going is you guys. Share it. Tell it to your friends. Give it to your neighbor. Send it to your boss. Just kidding. Download and subscribe. And as always, tune in next week to listen to what amazing show we have going on. I'm your host, Dr. Rady Rahban, and we look forward to seeing you next week on Plastic Surgery Uncensored.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.